Good morning, everybody, and I'd also like to thank the North American NATF for inviting us here to speak about nationalizing pulmonary embolism support groups. It's actually a very exciting topic for both Kathryn and I. Just to start with the background, the incidence of DVT and PE is 1 to 2 per 100,000 adults per year. That's annually in the United States alone, so that's quite a few people. The U.S. Surgeon General estimates that there are 100,000 to 180 fatal pulmonary embolism cases annually. Survivors of DVT and or PE may suffer from physical as well as emotional challenges. This is actually why we actually started our group. And there are more people who die each year from complications of DVT, AIDS, breast cancer, and car accidents combined. So you can see there's quite a few people, as Bob mentioned earlier today. Many people with DVT and PE suffer physical limitations. They have chronic venous insufficiency or post-thrombotic syndrome. Many patients experience pain, swelling, and tenderness. Some experience shortness of breath. And a severe complication of PE, as we know, is pulmonary hypertension, and this can be devastating for a patient. Patients have atypical chest pain. Some of the emotional challenges are stress, anxiety, depression. Many of the symptoms of pulmonary embolism are the same as having a panic attack, and after patients are diagnosed with pulmonary embolism, often some of those patients experience panic attacks and make frequent visits to the ED. They also have fear of the unknown, not knowing when this is going to happen to them again. And in today's world, of course, just with the parking prices, financial hardship if they have to come to the Brigham. Anyway, I know already why you're laughing at this next slide. But anyway, I had nothing to do with it. This has the history of DVT and PE. And it was started by, our PE support group was started by Dr. Goldhaber and myself. And now we do have Kathryn Mikkelsen, and she has many great talents, and she could also put these ridiculous pictures on this slide. Seriously, we have 160 members in our group now. 18 years ago, we started off, and we had maybe 4 to 6, and so that's a remarkable amount. We meet every 4 to 6 weeks. One of our typical meetings, we just usually start promptly at 7 o'clock. We go to about 8:15. People, we try to make the room so that everybody wants to talk to everybody and, conducive to seeing everybody else. And some patients go around, introduce themselves, and then, tell a little bit about their story if they feel comfortable. If they don't, we just go to the next person. Kathryn's actually arranged for guest speakers, physical therapists, pharmacists, nutrition, and we always try to leave at the end of the hour and 15 minutes, time for questions and answers, because they really like to hear what's new in the field, especially from Dr. Goldhaber. We did a little survey about our members, and the average member is 59 years old. The majority have only experienced one DVT or PE, thank God. And then the majority experienced their first PE or DVT over 5 years ago, which also says a lot for our group, because we have a lot of older members come back and really support the new members that come in. The most common emotional side effect that they mentioned in the survey was anxiety and frustration, and usually that's frustration over their diagnosis. This is some of the sayings that we took off of the survey that the PE support group members have said. They like learning about the disease and that others have the same problems, that there is help and support close by. They also like learning about information. For instance, I learned about home testing machines, and I don't have to go to the hospital anymore to do that. Actually, we have quite a few of our patients doing that now. They know that life goes on pretty much as before for the vast majority of patients with only minimal inconveniences. They also like hearing about the current status of research, and again, this is what Dr. Goldhaber is really good at explaining what's new in research to them. And it was extremely beneficial for me to hear that others had similar fears that I had. Just being able to express these fears and feelings was a tremendous help to me. And as our support group is beneficial to patients with PE and DVT, most support groups for patients with cancer, and this is also a very good group. The benefits, it allows the patients to share their experiences. They help one another cope with the challenges that they face, and they get increased knowledge, increased confidence, and they gain support. And they also learn a lot of up-to-date and accurate information. Now I'm actually going to switch to Kathryn, and Kathryn's going to go over the nuts and bolts of our procedure.
So thank you, NATF, for having us here today. Given the success of the support group that we've had here at the Brigham with Dr. Goldhaber and Ruth, we thought it would be a worthwhile effort to replicate these support groups throughout the United States and Canada. Our main objective, of course, is to help patients and to provide support that they might not get otherwise. So we're also going to focus on the unmet educational needs of the patients and their families, because a lot of the times the families, are impacted greatly by this. And we also want to raise awareness, advocacy, and education. And I think, today's a prevention forum, and I think this goes a long way to that too, so that these patients can learn how to prevent future PEs and DVTs, not only in themselves, but, spread the word to others as well. So our goals are to better educate healthcare providers on communication skills so they can have open communication with their patients about this, to develop a support group blog, which will actually be on the NATF website. We've started doing that. I hope to get that up sometime either this month or early June. We're going to do an evaluation just so we can see how we're doing, giving the sites the necessary tools to start these support groups and to make sure that the patient's needs are being met by these groups. And we're going to publish a document on how to successfully create and maintain a support group. The educational tools we're going to provide to each of these sites is a facilitator's guide, pamphlets to promote support groups to the patients, and I'm happy to say that both of these are actually at the printers as we speak, so we hope to be getting those out shortly. A blog on the NATF website where healthcare providers and patients can connect. A monthly newsletter, which will be an e-letter that will also come from the NATF website. Periodic teleconferences with other hospitals who are interested in starting support groups and those who have, so they can kind of connect and share helpful tools. And access to Dr. Goldhaber and Ruth, who have run a successful support group for 18 years. I just like to point out that I was 10 when they started this, so I don't have quite the experience that they do. But so there is a time commitment to start these support groups. And we do like to note that the people who start these, they are volunteering their time, which is very generous, because I know how busy we all are these days. We do put here that we like an MD, a nurse, and administrative support, but please note these aren't all necessary. We do ask, however, that interested hospitals have some sort of healthcare provider there, whether it be a nurse, MD, pharmacist, whatever, just because the patients find it really beneficial to have a reliable source to ask questions to. But it's a pretty minimal time commitment for the MDs and the nurses. It's about 1 hour per 4 to 6 weeks just to be at the meeting. For the administrative support, it's about 1 hour per meeting, and then about 1 hour of work to reserve the room, the guest speaker, send out the invitations. So far, we're pretty pleased with our progress. We have 7 individuals in Canada and 22 throughout the United States. And we're hoping to get the first satellite meeting scheduled in May, which is next week. So we're pretty excited about this. If anybody here is interested in learning more and starting at their institution, please come see Ruth or I. And just for those of you at the Brigham, our next meeting is May 10th at 7 p.m. and it's in the Duncan Reed Conference Room. So thank you so much.